So first time we want to see your child on a dental side is at the age of 1 or when first you set up. So we see your young child as young as 1. You guys grow with us all the way until you go to college at 18 or go to work. So it's a whole childhood experience. Technically, we'll be glad to take care of your child in different stages of we understand the development, the growth. That's what pediatric dentists are trained for. And our team are specialists. We're not just a general dentists, we're pediatric and orthodontic specialty. What pediatric dentistry provides. So we provide a lot of preventative care. Majority of our care is actually preventative and it's our goal. So it's a cleaning, scaling, using Cavitron scaling. Also we do sealants. Sealants is like a protective coating for the permanent teeth. And if your child happen to develop cavity, we do fillings, which is a white color composite restoration, which preserve integrity of your tooth. And if your child has a bigger cavity, then we do different type of crowns or caps. Some of them are stainless steel, which we still love because it's a less tooth reduction, or white crowns. Some moms don't like that silver, so we do stainless steel crowns. In my practice, we don't use amalgam. Everybody's scared of it because of the mercury content. Since I opened all my practice, I didn't even buy amalgam, we don't have. So we use only BPA-free, safe to use, good composite restorations and stainless steel, surgical stainless steel crowns. And if your child needs to have an extraction, we remove the tooth and we put a spacer. Sometimes do chair side if it's just 1 unit, or we had a scanner and we can do bigger type of space maintenance. So also we see your kids for emergency. If your kid happened to play, for example, basketball or baseball and broke front tooth, then we will do nice composite restoration or crown, which would match with the other teeth. And that's big of our practice. It's kind of a bread and butter of pediatric dentistry. Pediatric dentistry side is simple. The behavior side is difficult. So that's why we provide all kinds of sedations and different type of behavior modificational techniques. If we have a younger kids, for example, if we have 2-year-olds who are sleeping with a bottle and they develop baby bottle decay, for example, or just in general, somehow they develop baby bottle decay, which is front teeth advanced decay. If the child is under the age of 2, we actually provide non-invasive dentistry. So what we do, we apply SDF. SDF is a silver-based medication, silver diamide. So what it does, it kills the bacteria and stops progression of the decay. When your kid is older, but they still have like just naturally very high anxiety, then we can provide oral conscious sedation. When your child is not completely unaware and unconscious, they're just more relaxed. And some of them watch TV and kind of take a light nap. We monitor with hospital level monitors. And that way we can provide care for that child like I did for my own kid when he was little. Oral conscious sedation is kind of a unique niche, which is dying art, I would say, because in many practices it's just either laughing gas or general anesthesia. There is no middle ground. We provide middle ground, which a lot of parents appreciate. When the child becomes more comfortable, easygoing, then we may use just the laughing gas. And then laughing gas, we kind of phase your kid out at the age of 10. When they reach 10, some kids 12 age, we're saying, you know what? Now it's time to develop your coping skills. At 10, we're doing just local injection and doing treatment without. But local injection, I have a new tool. I love new technology, and now we're using SONO. SONO is a new type of computerized admission of local anesthesia, which is very gentle and it does not hurt. Now all the moms, if you're part of our practice, they're like, Dr. Olga, what are you doing? What is this? I'm like, it's a thermometer. We don't use needles anymore. It's new injection technique, but it's computerized admission, has very tiny little tip on it, and it's slow, and it numbs really good. It numbs just the tooth, not the whole mouth. So we are introducing those technology every time. And once when we bought this device, it was funny because I was driving with my husband and I was telling him, Adrian, I am in love. I am in love. He's like, what? I'm like, I got this amazing device. I'm such a nerd. I'm like, I got this amazing device, which doesn't hurt when you do injection. It's so cool. And it makes me my job less stressful. Kids love it. Everybody's happy. So that's positive environment we're trying to create. That's our brand, Palm Valley Pediatric Dentistry. I always listen to different new advanced technologies. I'm taking different lectures. I'm trying to be open-minded because now dentistry is becoming part of the big picture. It's part of medical assessment of the children and so on. So Airways became a big deal now. So now, taking a lot of CE classes, now we're helping actually newborns. We're doing assessments with lactation specialists. We do go by recommendation. We work with lactation specialists as a last resort. If that baby cannot improve with transferring milk or sucking, then we would do release of lip and tongue tie. So we actually have lactation consultant in our Goodyear practice, and we screen kids for any type of restrictions in the mouth. So if mom is struggling with nursing, then we will be glad to take care of tongue or lip tie using special CO2 laser. CO2 laser is different from diode laser. CO2 laser evaporates water from the tissue, and that way it cuts, so healing is faster. There is no recorded infection. So CO2 laser is the laser you want to have. Our practice is integrated. We have orthodontics and pediatric dentistry. We use Panoramic X-ray for our patients. We do it from the age of 6, and we do it every 5 years. And orthodontist, he does use this part of machine, which we call cephalometrics. Cephalometrics is when we actually measure the profile of the person, see all the dimension. In orthodontist based his recommendation based on cephalometric mostly, and panoramic as well. So this is a really big part of overall diagnosis. We're all digital. It's actually a big part of our practice, and I bought the best sensors. Ours are chic sensors. They are pricier than average sensor, but we get the best image. It's less radiation because it's digital. Sometimes you can misinterpret diagnosis and miss a cavity or see more cavities than you should. So it's kind of very, very important to have a good quality X-rays. The distinct characteristic of our practice is that we are, as I was telling you, trying to keep up with technologies. Now, Invisalign scanners is kind of an emerging field. Now braces, they call it analog, and Invisalign is digital. So analog is old traditional braces, and digital is new technology and clear retainers. So we have this awesome iTero scanner. So now it's not scary. I don't know, moms, if you remember that gooey stuff we had to put in your mouth, you have to sit still for 5 minutes until it's set. Guess what? We don't do it anymore, only for special occasion. But most of the time we use this amazing iTero scanner, and we scan. So kids are just sitting in a chair, and we are just like scanning the whole mouth. And now we're able to do it on pediatric side as well. Now Invisalign, surprisingly, we can do it actually on little kids as well. I like it because I see improvement on oral hygiene, because with brackets, braces, it's kind of tricky to brush around every single tooth after you eat. With Invisalign, we see more and more improvement in oral hygiene because they have to brush their teeth before they put the trays in, and it's not as difficult. So we're kind of slowly switching case by case towards Invisalign, and I think it's the future. Remember, digital versus analog. That's how we do it here at Palm Valley Pediatric Dentistry and Orthodontics.